You had the numbness, but I mean, this is the first time that the hand began to feel like it just had a lot of it. Is that right? Huh?
Feels different.
Yeah. Try it again. Try another compound and see what deep anesthesia you can have.
Okay. Have you tip your head back. I'm gonna have you tip your head back again. And your hand's going to increase about 10 times again. Tip your head back. Come forward. Feel anything there?
Yeah.
Now, Doctor, he's pretty well got the idea of anesthesia. I bet that's the best anesthesia he ever had in his hand in the past 5 sessions. Is that right, Doctor? Huh?
Yeah.
No.
It's different.
It is different. That's what I wanted, because if you can feel that, then you know what compounding will do. All right, Doctor, if you've got that, now
close your eyes and then just stroke that numbness clear out of there. Okay, open your eyes. Go on.
Oh, no, Doctor, how do you feel? Don't forget.
Go on, down.
You don't have to ask if it's gone.
How do you feel?
But don't forget that. That's the first lesson in hypnosis. Wake them up with health suggestions.
Well, I didn't know that I was through with him, man.
Oh, yes. The minute that you have him open his eyes, the hypnosis is over. There's no suggestions writing.
Yeah.
But that was pretty good work, Dr. Bowman. Nicely done, because you kept compounding until he could actually feel it, but good. And he needs that, because...
How come you didn't want your job?
I don't know. I think I still got some...
Numbness there?
No, I still have some fear about the job business.
Yeah, I wouldn't doubt it. When we get to the 7th session, I'd like to do some hypnoanalysis on that one.
You don't need to analyze me. I can tell you what it was.
Well, that's all right.
Remember
You want to remove it. You want to remove it, don't you?
Oh, yeah, sure.
That's what I mean. That hypnoanalysis will remove it. All right, Doctor, will you come up, please?
Now, Doctor, we have real good physical relaxation. Now let's get some mental relaxation. In just a moment, I'm going to ask you to start counting backwards from 100. And when you do, I want you to double your relaxation each time. Double, after you say 100, the relaxation that you have now. Now, start counting.
100.
Now, double your relaxation.
99.
Now, double your relaxation and the numbers will disappear.
98.
Double your relaxation.
97.
Double your relaxation. The numbers will disappear.
96.
Now, you see, now you've got what I'm talking about. So long as you have that, you've got something that's impossible to work with. Because all you've got is light hypnosis. Now watch how we turn that. This is the important thing. Watch how we turn the artificial somnambulism to true somnambulism. I lift the hand, and I say to him, now, when I lift the hand and drop it... No, doctor, stay relaxed. Stay completely relaxed. I'll lift the hand, and when I drop the hand, the lights will go out. No, let me lift. Don't you lift. Let me lift. Don't you lift at all. Don't you lift at all. Just, you can't lift. Think of it that way. When I lift the hand, that hand will drop. Oh, you're lifting, doctor. When you do that, you just defeat me, and you don't want to defeat me.
Start all over.
All right.
Start all over.
For some reason, you're nervous.
No, I was...
I could tell he was helping me when
I was helping him.
No,
and, all the way.
Yeah.
So let's start all over.
All right. I start from 100 and make the number start.
I was ahead of him a while ago on the 100.
All right. Now, I want to make sure first that I got the physical relaxation. Let me just lift it. That's it. Don't you help. Don't you help. Don't help at all. Don't try to help me. Just follow orders and don't help me. Now you got it. Could you feel the difference, doctor? That's how I want you to be. In other words, don't say to yourself, I'm going to help him. I'm going to help him. Because that will defeat it. In other words, instead of saying, I've got to help, just say to yourself, I'm just going to listen to him and follow orders. Now, start from 100 and make the numbers disappear, doctor.
100.
Now, relax. Double your relaxation.
99.
Now, double it again and watch them fade out. Make them fade out.
98.
Now they'll be gone.
Are the numbers gone?
Now, why did he fail before and why did he succeed this time? He was trying too hard to help And so he was kept himself at a conscious level, not that he isn't conscious now, but he kept himself at such a conscious level that he didn't follow orders, but rather tried to assist you. I think he'll tell you himself that that's what happened. But doctor, can you tell the difference when you relax like this and the way you were before?
Mm-hmm.
Huh?
Mm-hmm.
Now, suppose he hadn't let those numbers disappear. Let me show you the technique I would have used for removing those numbers. I would have lifted the hand. Oh, what beautiful relaxation now. When I lift the hand and drop it now, the numbers will drop out with it, and the lights will go out, and you just won't be able to see any more numbers. There they are. Lights go out, and all numbers gone, right? See? That's how you would change it to true somnambulism. All right, doctor. Now, go ahead, and you should have a perfect result at this point, because he's got a beautiful state.
Now, Jim, we're going to stroke your jaw, and when I do, the numbness will come into your jaw, and your jaw will begin to get numb. 1, 2, it's getting numb. 3. Now, how does your jaw feel? How does your jaw feel?
Not much different, is it?
It's all right. Now let it wait a couple of seconds. He may have a delayed reaction. Remember, he's been giving xylocaine for many, many years. May have be a delayed reaction. Ask him again now.
How does it feel now?
Little different.
Say
Good,
again.
good.
Now that's
good.
all you need is a little to compound. But you have to have a little. If he had started compounding before, when he said not much different, he could have compounded to the end of time. And nothing times nothing is nothing. But now when he's got a little bit, watch what he does with that little bit. And doctor, this is very important that you do this all the way. Because if we can once show this, it shows him what he can do with it. You know what I mean? So make it happen on him. Huh?
Now, Jim, in just a moment, I'm going to lift your arm and drop it again like we did a while ago. And when I do, your jaw will get twice as numb as it is now.
Mm-hmm. Now, why stop at twice as numb? 10 times as numb.
All right, 10 times as numb.
I mean, I don't want you to make it preposterous, but I do want you to make it...
You don't want to make it incredible.
That's right. Don't make it incredible. But certainly you could have 10 times as much numbness. Now
how does your jaw feel?
No, don't put the critical factor back in focus. You can tell us, how's the one jaw, how's the side of your jaw feel? Can you feel a change? All right. Now, doctor, but there is more numbness than there was before, is that right?
Yeah, I think so.
All right. Now, doctor, it's when the opening of the eyes occurs, and this is oftentimes so difficult to get over to the doctors. Your first big surge comes when the eyes open.
Is that your first compound?
That's your first compound. So, in other words, you don't want to compound a little. Because if you compound 1 times 1 is 1. But 10 times 1 is 10. So when I have you open your eyes, that numbness will get about 10 times stronger. And it will, doctor. Well, you felt it on yourself, didn't you? See, when, I don't know who it was that worked on you. Who was it? Who was the worker?
Dr. Perry.
Well, when Dr. Perry did it on you, couldn't you feel that numbness just get about 10 times stronger when you opened your eye? Now I want you to do the very same thing with him. So don't keep his eyes closed because it'll only get...
Now, Jim, in just a minute, I'm going to ask you to open your eyes. And when you do, open them and close them.
Mm-mm. When you
open them, your jaw will feel 10 times more numb than it is now.
Now give that suggestion all over again.
Now, Jim, in just a moment, I'm going to ask you to open your eyes. And when you do, your jaw will be 10 times more numb than it is now.
I want that to happen. We'll watch it happen.
Now open your eyes.
How's your jaw?
I think it's a little longer.
All right. Now compound and let them see the difference.
With the eyes open.
With the eyes open, yeah. Right?
Now, Jim, get your head back here on the headrest. Come way on back on the headrest. Now, when you lean forward in just a moment, your jaw will be 10 times more numb than it is now. Now lean forward. How does it feel now?
Got
Now you've got a difficult case there because of the fact that he's keeping his credit. See, he had a lot of failures the past 2 weeks. I can tell. Is that right?
Well, I'm listening to both of you, and I'm trying to help him pretty hard. I just drove in from Shreveport too. Before I walked in here, so it might be.
Let me
tell you the truth. I don't have any difference in my jaw right now.
All right, close.
But I did feel relaxed.
Yeah, I know. Close your eyes. Let me do this, and then I'll have you work on somebody else, because I must have him feel this, I feel. All right, doctor, close your eyes. Make your eye muscles relax to the point where they won't work. Test them. Let that physical relaxation be complete. Don't try to help me, but don't try to fight me. Just want it to happen. I lift your hand and drop it, and when I do, all those numbers will drop out. No, now you're helping me again. Don't let it be just like it was before. Completely relaxed. And you'll find out that you're going to feel so much better as a result of this relaxation, because driving from Shreveport can be quite taxing, and I don't want it to be taxing on you at all. I want you to be so relaxed that when it... Now you got it. That's it. Now, doctor, we've got the physical relaxation. Start the mental relaxation now. Start counting from 100 backwards and make the numbers disappear. You got to will them away.
100.
Now, notice how good you feel, though, when you make it happen.
99.
That's right. Now make it happen.
98.
Now they'll be gone. Make them disappear. Just order them away. All gone? No. Now, doctor, I want you to feel this because I want you to know what your patients feel. So I'm going to stroke your jaw 3 times and you'll feel numbness come in there. 1, 2, 3. How's your jaw, doctor? Begins to feel it now, right?
I think so. Yeah.
All right. Now, doctor, let it get a little bit stronger now. Now, in just a moment, I'm going to have you open your eyes, and when you do, that numbness is going to get about 10 times as strong. Now, open your eyes. How's your jaw feel?
Feels number.
Yeah, feels number. Now, put your head back and bring it forward, and watch how numb it gets then. That's right. Now, doctor, I'm going to take that anesthesia and I'm going to put it on the other side of the jaw. Now watch how it travels right around your jaw. I'm doing this for a very special reason. Now, how's the left side of your jaw, doctor?
Oh, about to say it was.
How's it now? How's it feel now?
I can't tell much difference.
All right. Now I'm going to bring it right down. Now, how's the right side, doctor?
I can't tell much difference.
Doctor, I think he's got it. Make a test. Go very light until we're sure that he has it. I got on the right side. Now look.
Jim, let's make a little test. Open just a little bit.
Go easy until you know you've got it. And then see that once you know you've got it.
Felt it just a little thing, didn't you? How much you feel it, Jim?
No, much.
Right at the last a little?
No, much. I just knew you were burning down hard.
I was breaking the tissue.
Well, I didn't feel that. I knew you pushed harder, and
I was breaking through.
Yeah, all right.
Well, I didn't feel anything.
Okay, well, that's okay, but then we have got it. And that was very important. No, let me just take it away. All right, when I stroke your jaw now, that's going to feel better and it's felt all day. You're going to feel very relaxed as a result of your trip from Shreveport. And instead of it being a tiring thing, it's going to be a restful thing that you had that trip. 1, 2, 3, and now when you open your eyes, notice how relaxed you feel. Hold on to that relaxation. Do you good. How do you feel?
Fine.
You gave him a good test. All right.
I didn't feel anything.
Yeah.
I didn't have the pronounced numbness. I couldn't tell any difference.
No, doctor, because he did compounding on you. But as I did the
But
compounding.
Jim, that's with me. I don't get the...
I don't feel any difference.
It's not things.
Of course, I have a picture when that jaw mandibular injection, it's just frozen. You just, you know.
Many people
Maybe that's
get
the
that.
picture I'm trying to put to it.
Yeah.
But I didn't, I felt nothing. I knew you bore down the last time harder, and I knew what you were doing, so I thought I'd give a little. But it didn't feel it.
Now, the reason I took...
And in fact, my jaw feels the same right now as it did a while ago.
Now, doctor, the reason I took over that point, I'm going to have you practice somebody else to make up for it, is because if he's been working for 2 weeks and every once in a while having somebody hold on to the numbers and he doesn't get any place, it's pretty discouraging for a guy who's been very enthusiastic for about 8 weeks and then all of a sudden he goes haywire, isn't it?
Well, I've been enthusiastic. The reason I forgot the numbers the first time, I fudged a little bit. I was kidding myself on it. Between listening to both of you.
Yeah. But now, once this happened, when you couldn't feel him breaking through tissue, doctor, you got pretty good anesthesia.
Yeah,
isn't that right?
yeah, I'll go along on that.
Yeah. Now, let him practice on somebody else before I have you practice, huh?
Okay.
Just practice. Hey, come on up. Would you try it again? Yeah. Don't mind, Dave.
I was discouraged in twice.
Huh? No, look, he's not discouraged because he knows that this is something that I had to have happen because this was a student and I wanted to make sure that he got it, because if he didn't get it, it would mean that with confidence he couldn't go approach his patient. He couldn't get it himself. How could he approach his patient with confidence? So I wanted him to have it. So that was the reason. All right, doctor.
Now, doctor, we're going to show you the medical way to relax today. First thing you do is take a good long deep breath. That's it, and just let it out and relax. Now let's uncross those hands right there, please, doctor. And just let your eyes close. And let all the muscles around your eyes close.
Don't tell me.
Let them relax to the point where they feel like they just won't work.
Fine.
Now, when you're sure that your eye muscles are that relaxed, and when you're sure that they won't work, test them and make sure they won't work. That's fine. Let them stay closed. Let them stay relaxed. Now, get that feeling of relaxation around your eye muscles there, and sense it and let it go all the way down through your body. Just let that feeling of relaxation go all the way to the tip of your toes. Now, when you're sure it's all the way down, I'm going to make a test here. I'm going to lift your arm a little ways and drop it. And don't you help me any, and it should drop just like a limp dish rag. Don't help me any. Let's let it get more relaxed. And just let it go down kerplunk. Just let it fall.
How much better? How's it coming, doctor? I think we'll have to mental relaxation.
Now, we've got good physical relaxation, doctor. Let's have some mental relaxation. And what we'll do is in just a moment I'll ask you to start counting backwards from 100. And with each number, I want your relaxation to get 10 times deeper than what it is now. And by the time you get to 98, the numbers will disappear. There just won't be any more numbers there. Now start counting.
100.
Now let yourself be 10 times more relaxed.
99.
Now let yourself be 10 times more relaxed and the numbers are going to completely disappear. They're all gone. Are the numbers gone?
No.
Well, let the hand drop and let the lights go out.
Okay, doctor, in just a moment I'm going to lift your hand and drop it. And it's going to be so relaxed that when it drops down, the lights are just going to go out and the numbers are going to disappear. Now just let them disappear.
Gone?
Are they gone?
Gone.
Good.
Gone. See, you
Good.
get it. Sure. All right, now, doctor, you do the same thing with him that you could do with anybody in the world that had this state. We had two opportunities to see artificial change to true. They saw it before the class, before the class studies began. the actual practice. And then they saw Dr. Who'd you have artificial on? Oh, yes, the lady. And you changed it very nicely to true somnambulism. And the funny thing is, when you change this artificial to true somnambulism, you can just notice the way the person gets the increased relaxation when the true state comes along. In fact, we might ask the last lady who was up here, could you feel the difference when the numbers disappeared? Sure you can. It's a terrific difference, terrific difference. You try to get somebody to explain what the difference is, and the most I can get that is usable seems to be that you are much more content. There are no conflicts once the numbers disappear. I know you did. But once you succeeded, there were no conflicts anymore. Now, in somnambulism, suggestions become tremendously more effective, and many more kinds of suggestions can be given. The truly somnambulistic patient is almost entirely uncritical of the suggestions which are given to him, and will, to the extent of his capabilities and his need, endeavor to accept them. Now, it was at this session that in our last Wichita class, one of the men became tremendously effective in helping the victims of carcinoma. I'm talking now about Dr. Tinterow. Dr. Tinterow had done some good at the third session, and between the third and the fifth he'd done some good work. But when it came to the fifth session and he began compounding suggestions on cancer victims, that's when he began to get his real help. How many of you are already using this on cancer victims? How are you doing, Doctor?
Well, my patient died.
Well, that's all right. I mean, it's used on terminal cases. We expect that.
I was able to give him some relief. Quite a lot. I just got a chance to use it once after our last session. And then he only lived about 24 more hours, but they were quieter hours.
Yeah. It makes their passing out so much easier for them. So much easier for them. It's just like a boon to ease their suffering in the final hours. But you see, the very fact that a couple of men in class are already using hypnosis for things that 10 years ago they said couldn't be done. And as a teacher, I feel proud when that happens in a class. Last night, too, we had two men in the Kansas City class who were already using it on carcinoma victims. And when you think to yourself that Montefiore Hospital in New York this previous fall thought enough about our techniques to give a clinic to one of our doctors in class so that he could work with nothing but cancer victims and see how much relief he could give them. It won't cure cancer, but it'll certainly give a terrific amount of relief. Now, think of it this way. In the light state of hypnosis, the patient seems to be saying to the doctor, gee, doctor, I hope this works. Once he gets the deep state, however, the attitude of the patient seems to be, oh, doctor, I know this is going to work. This must work. And so it works beautifully. I believe that the doctor studying hypnosis can be made to understand the reason, the true reason why people accept suggestions better in somnambulism than in almost any other state, that he'll be more adept and adroit with hypnosis. Here, then, is the explanation. You know already that hypnosis is a form of relaxation. As the patient relaxes more and more, deeper and deeper, this relaxation brings on a feeling of euphoria, a feeling of well-being, a feeling of contentment which the patient has perhaps never before known. As this feeling increases, he gets an increased sense of confidence in himself and the doctor. In this euphoric state, it seems to the patient that all is right with the world, and that anything within human reason is possible, and he therefore accepts at face value, without criticism, almost any suggestion which appears reasonable and pleasing to him. And let's leave out that word almost. He will accept any suggestion which appears reasonable and pleasing to him. Again, let us stress that in somnambulism, you do not achieve a zombie state. The patient does not lose consciousness. Instead, he gains awareness. It has been variously estimated by authorities on the subject that in somnambulism, awareness of the patient is increased up to 2,000%. Take the young lady who was able to see herself learning how to walk again. Gee, you've got to have your awareness increased tremendously. I can think back to incidents when I was maybe 3 or 4 years old. But to try to think back to incidents which occurred when I was a year old or less, well, that's pretty tough. But when awareness is sufficiently increased, you can actually do it. And you see them very clearly, crystal clear. Imagine she was able to say that she had on a yellow dress. She was able to say that her mother was wearing a print dress. that had various colors in it and so on, but it was a light dress. So, you know, she moved over to a red couch. When you see these things in Technicolor, you can pretty well be assured that you're seeing the real thing and not just a dream state. You know what you have to do to achieve this state, and the reason that we got through practicing so fast out here is that every student, one after the other, shortcut. And I let them shortcut because the person with whom they were working went into a sufficiently deep state so that they knew that they were shortcutting. Was there anyone who didn't know that they were shortcutting? You all realized that instead of giving 3 visits to Bernheim, you were letting 1 visit take the place of 3. And I think out there where you made them probably go through 3, is that right? Well, I had them out in here when I saw that they knew what they were doing and that their semantics were entirely correct. I let them shortcut to let them see that they could obtain the state very quickly. Now that you've gone through 5 sessions, you are at liberty to shortcut and endeavor to obtain the state within a minute. What do you do when you meet with resistance on the part of the patient? Don't try to produce the hypnotic state. Since hypnosis is a consent state, it is useless to carry on so long as resistance is there. In certain cases, you can eliminate much of that resistance by saying to the patient, "Too bad, you don't want it the easy way, we'll have to do it the hard way." The patient will usually become apologetic, a little afraid of the physiological pain that is bound to ensue if the treatment is given the hard way, and will try to cooperate. With resistance gone, you will be able to gain the state on many of these fighting patients. If the patient continues to resist, quit trying. I always say that I'll quit trying within 1 minute. If the patient fights me over a minute, I say, well, the patient doesn't seem to realize that I want to help him or want to help her. If she doesn't realize that I want to help her, let her have it the hard way. And I say that even in cases of delivery. If the woman does not want to cooperate to the extent of relaxing and getting the state in which painless delivery is possible, if she wants to feel the delivery, let her feel it. But if you let her feel it generally for a contraction or 2, she'll generally say, "Oh, doctor, help me to relax." And then you'll find that you can get her into the state and you can help her the rest of the way. But I would certainly say that the patient who shows you conflict, resistance, fight, hypnosis is a consent state. Hypnosis can't stand a fight. You're bound to be the loser anyway. Quit trying. You'll be much better off. You save your temper, you save your feelings, and you've got medical helps for the patient who resists anyhow. Use what you've always used before you started learning hypnosis. Make sure you have true somnambulism. At all points, make sure you have true somnambulism. If artificial somnambulism has any value at all, and by others it's often called the medium trance, its value is that it acts as a gateway to true somnambulism. Remember that. Working with a patient while his eyes are wide open in deep hypnosis seems to be one of the things which the doctor does not understand that he learns to do at this session. And we've had doctors come back to the 7th and 8th session and say, "Well, how do you work a patient with the eyes wide open?" Well, the whole theory of it is give them a suggestion with the eyes closed, which will stay in effect with the eyes open. An anesthesia suggestion is the perfect way to keep the hypnosis riding with the eyes open. It's a good medical way. Then you can do all of your work with the eyes wide open. And it's the state that is much to be preferred for many people and for many doctors to use. Now, here's what I used to hear when I was a child. When I was being trained in hypnosis by probably the most adept and adroit operators the world has ever known, they would say to me, "Dave, if you want to tell a ham operator from the good operator, you can always do it by noticing whether he works the patients with the eyes closed or the eyes open. If he works the patients on stage with the eyes open, he knows what he's doing. If he works them with the eyes closed, he's an amateur. You notice men like Polgar. Polgar works them with the eyes wide open. And despite the fact that I don't respect everything that Polgar does and disagree with him in many things, Polgar is probably the greatest public operator that we have in America today. And certainly I don't want to detract from his ability nor his knowledge of the subject. Polgar would never dream of working patients with the eyes closed. Now, how does that work in a doctor's office? The advantages of the eye-open state is just this, that anybody can walk into your office and they don't know that you're using hypnosis. They haven't the slightest idea that you're using hypnosis. It's not waking hypnosis that you're using. It's deep somnambulism with the eyes wide open. It's a completely different state. It's in this eyes wide open state that you can say, now I'm going to put the anesthesia over here. And the anesthesia transfers. I'm going to put it from one hand to the other. I'll snap my fingers and the anesthesia will jump down to your toes. That's the state which the stage operator uses so beautifully. And since we know that this is the much to be preferred state from the professional operator standpoint, for instance, I would never think of doing a demonstration and keeping the patient's eyes closed during the demonstration. Why, I'd look like a veritable amateur.